Thank you, everybody, for joining us today. Before we get started, I'll just give everybody a few reminder housekeeping items. For the premiers at the table, if you wish to speak, you have to press your button for your microphone to work. We have media on the phone line joining us today. If you have a question, please press *1 to enter the queue. Everybody on the phone and in the room will be limited to one question. We will start with questions in the room first and on the phone second. Please direct your questions to the Premier that you wish to have a response from, and clearly identify yourself and your outlet when you step up to the mic. I will now hand it over to Premier John Horgan.
Thank you very much, Lindsay. Good afternoon, everyone. Thank you very much for joining us here in my hometown, the traditional territory of the Lekwungen-speaking people, the Esquimalt and Songhees First Nation. We've had 2.5 days of vigorous discussion about all of the things that bring us together in Canada, as well as the challenges we face region by region, province by province, community by community. It has been an invigorating time when you have 13 Canadians coming from different perspectives, different places, all with a common goal, and that is to lift up the citizens in their communities to ensure that Canadians can have the best possible outcomes during the very challenging times we've all been through. During the COVID-19 pandemic, this group, the Council of the Federation, met over 40 times as premiers to discuss the challenges we were facing in our communities as a result of a global pandemic. Throughout that time, we met with the federal government 36 times, and the collaboration and cooperation was, quite frankly, unprecedented in our history, and the outcomes for Canadians were also unprecedented. Although we were facing the same challenges that other communities were around the world, outcomes for Canadians were better because we were working together, using our public health care system to protect and preserve the well-being of our citizens. But now that we're coming out of the pandemic and looking forward, we see more challenges. Climate change, rising cost of living and affordability issues with respect to inflation, as well as a number of other concerns that we discussed over the past 2 days. Although Monsieur Legault and I have been regularly briefing you on our discussions with respect to health care and outcomes for Canadians and how we need to invigorate and revitalize our public health care system by focusing on a new reimagining of how we can meet the needs and expectations of our communities, we also spoke about the challenges of strengthening our supply chains, bolstering our labor market, addressing climate change, of course, enhancing our energy security and food security, as well as struggling with the challenges of mental health and addictions in communities across the land. And lastly, we had a very good discussion led by our territorial leaders on the challenges of Arctic security and Arctic sovereignty. All of these issues are on the table. All of these issues are facing people across the country. And as leaders, it's our obligation to find the best way forward. With respect to affordability and inflation, all of us are coming at this with different perspectives, different approaches. And I think that's the strength of the country historically, and it's certainly the strength of the country today. We have a diverse group of political perspectives here. We have linguistic differences. We have backgrounds, cultural backgrounds that are different. And we're able to take all of those differences and celebrate them and remember and reflect upon how fortunate we all are to have our Canadian citizenship. But the number one issue for us for the past 5 years, and in fact, even before I joined the Council of the Federation, is public health care. We see the strains and cracks in communities, whether it be primary care, whether it be acute care, whether it be our long-term care infrastructure. We see new and emerging technologies that are costly and requiring more investments than ever before. We've seen, of course, a rise of awareness and understanding of our need to address and tackle mental health and addictions, as well as, of course, new pharmaceutical and therapeutic solutions that are also costly and require major investments if our citizens are going to benefit from the innovation and the dynamism of those working in the healthcare sector. And most importantly, speaking about those people, we remember all of us celebrating every night at 7 o'clock by coming out onto the street and banging pots and sending our gratitude to frontline workers who are going and risking themselves and their families to keep the rest of us well. And we enjoyed and embraced that initiative, but it was symbolic. We need now more than symbolism, and that's why we've been calling on the federal government to come and join us, to sit at a table, to talk about these pressing issues, because Canadians expect nothing less from us. And with that, And I welcome any questions from you, and all of my colleagues are here prepared to answer any issues you want to bring up within the context of those we've discussed, and potentially any others that you believe are relevant to the Council of the Federation.
Thank you, Premier. As a reminder to those on the phone line, please press *1 to enter the queue. First question, Richard Zussman, Global News.
Premier Horgan, you spent months leading up to this meeting speaking about the importance of health care. You come here and you don't get anywhere on health care. You have a final communique that doesn't even mention health care, and I understand you had information out this morning. How disappointed are you that we're no further ahead now? And I know you spoke to doctors and nurses who proposed a number of things that did not need new money, licensing issues, different payment structures. Where are we at with that, even though you weren't able to get somewhere on money?
Well, first of all, we issued a communique this morning on the #1 issue, so to suggest that we didn't raise public health care in the final communique, I think is a paper processing issue on your part, not ours. We were out this morning talking about colleagues have been working in our own communities, working with stakeholders, working with patient groups, working with doctors, social workers, nurse practitioners, registered nurses, the whole continuum of healthcare providers looking for solutions to the challenges ahead of us. And although there are issues that we can address that don't require initial investments or additional investments from the federal government, such as licensing, we do in the final communique talk about regulated professions and how we want to see more labor mobility within the country, and also with those who have credentials, foreign credentials, we want to see those recognized more rapidly, and we're working on those strategies all the time. But at the end of the day, what we need to do is infuse some resources into the system so that we can get the outcomes that people want to see, and that is having a national human resource strategy so that we don't find ourselves poaching from each other and outbidding each other to find the healthcare professionals we need to provide services in Canada from coast to coast to coast. That's why we come together. That's why we have a federation, so that we can have national standards and national practices. But at the end of the day, the jurisdiction for delivering the services rests with the provinces. And historically, that exchange of responsibilities was we deliver the services and we share the financing of those services at a 50-50 rate. We're now down to about 78% on the provincial side, 22% on the federal side, and that's just not acceptable. We don't want to quibble about the money. We want to get at the table to talk to the federal government. If they're not acknowledging and recognizing the crisis in communities across the country, they're asleep at the switch, quite frankly, and we invite them to come and talk to us about how we can work together to get the outcomes Canadians deserve.
Next question, Binder Sajan, CTV.
Premier Horgan, just want to ask you, with regards to getting the federal government to the table, it appears that you've failed to do that despite the consensus with the premiers right now. Given the comments that you've heard from federal ministers, do you feel any hope that you're a little bit closer even to getting the federal government to the table?
Well, I sat down with the Prime Minister last November, and I had just come out of surgery. I was facing 35 rounds of radiation treatment for throat cancer, and I was vulnerable as a human being and as a premier. And the Prime Minister and I had a candid and frank discussion about the importance of making sure that as we go forward, we're working together to address the challenges of patients and those that are accessing our healthcare system. The Prime Minister gave a commitment to me that he would task his ministers to meet with us, and we as a group agreed that we would look at a diverse group of premiers. We selected Premier Fury from Newfoundland, who's a surgeon, Premier Moe from Saskatchewan, who was the past chair of the Council of the Federation, coming from the Prairie, and myself as a representative group of premiers to sit down with the appropriate federal ministers to set the table for a discussion about how we go forward. That was 8 months ago. And we started with a meeting in January where we reaffirmed the need to have a face-to-face meeting. And after that, it got quiet. We had a couple of phone calls with the Minister of Intergovernmental Relations, and that was it. I got a phone call from that same minister on Sunday morning, the day we started this conference, asking how things were going. And I gave him a candid response to that question. And here we are.
Next question, David Cochran, CBC.
Hi there, Premier Horgan and any other premiers who'd like to answer this. Federal Health Minister Duclos was just on Power and Politics and was asked about your request to have a First Ministers meeting. And instead, what he said needs to happen is a conversation about results that would be achieved before you can talk about money, And his view is that that is a conversation that needs to happen at the health minister's level to get that sorted out before you can have a first minister's meeting to talk about money. So I see some heads shaking. I wonder if we can get some reaction to that.
Well, again, we're not here to be fodder for power and politics, but although it seems to me that the federal government wants to negotiate through your program, so if that's how we're going to roll, I guess we can do that. That's firstly counterproductive, and secondly, again, I use the word disingenuous. Mr. Duclos has had an opportunity to have those discussions with us for 8 months. And to now, as we gather here in Victoria to talk about how we go forward, to say, I got an idea, why don't we talk about outcomes? That's what we told them 8 months ago. We shared a basket of initiatives with them, and nothing came back. Nothing came back. So with the greatest respect to the federal ministers who are now suggesting that everything is fine, go and talk to human beings. Go and talk to patients. Go and talk to healthcare providers, and they'll get a different message. We are echoing what people are telling us in our communities across the country, and I welcome my colleagues to respond to this because I feel that I'm holding them back from what they really want to say. Francois, do you want to start?
Anybody else want
Doug,
to
go ahead.
Yeah, sure. Sorry. Well, first of all, thanks for the question. I want to start off with thanking Premier Horgan for hosting us. He's been incredible. He's been an incredible leader for BC and the entire country on many issues, but especially healthcare. So thank you. You know, as Premier Horgan said, it's pretty disingenuous when you have the minister come out and say, you know, well, here are a few ideas, and by the way, hand it over to your ministers of health. It's just one request. Come to the table. Come to the table, start the discussions. We've been asking for this for years, all the way back to when I first got elected. So it's unacceptable, and we need to sit down and see the investments. Tell that to the patient in Ontario that's waiting for a hip replacement or a knee replacement, or as simple as cataracts, or the backlog surgeries that we face every single day right across this great country, from coast to coast to coast. You know, that's what we need to talk about. You know, people don't care where the money's coming from. They want action. They don't want to see a backlog of surgeries, which majority of us are facing. Come to the table. We'll meet you anywhere, anytime. All 13 of us will put our schedules aside to sit down and start the discussions. But to sit back and communicate through the media, it's really insulting to all the people of Canada and insulting to 13 premiers.
I would just echo on the results piece in particular. We've been very open that there's none of us here who wants worsening results in Canadian healthcare. What we're asking, and I think it's reasonable, and I think it's demanded of Canadians, is an opportunity to use this time of disruption, which I think we can all recognize we're in, to reinvent and reimagine a modern Canadian healthcare system. I think we need to have a mature debate about where that goes, and there's been some commentary about the 22 versus 35 and the calculus surrounding it, but that debate needs to happen at a table. And all of us here today are committed to that table, an open, collaborative discussion that Canadians frankly demand, and more importantly, deserve. I've been on the other side of a gurney. I've had to cancel surgeries. I've been dealing with nurses who have worked 24 hours in a row, seen nurses leave the OR crying because they can't get to a family member's wedding. I've lived it. The time has come, the pandemic has heightened it, but now is the time for all levels of government to work in a collaborative way to modernize the system, to deliver Canadian level, all of which we celebrate around the world, have operated around the world. We are known around the world for our standards of care. We can do it, but we need to do it together. And exchanging rhetoric in the media is unfortunate, but we have to come together collaboratively in order to save the Canadian healthcare system.
I can go, maybe. We are here 13 premiers who say the same thing. We cannot afford anymore to finance 78% of healthcare expenses. Healthcare expenses in Canada right now, it's over $200 billion a year. So what we're asking for is to meet the Prime Minister, that the premiers meet the Prime Minister. We're not asking that he delegates that to a Minister of Health and our Minister of Health. We need to have a meeting. It's a real problem. It's the most important problem in Canada. So I don't understand why Mr. Trudeau doesn't want to meet us. And it's a bit insulting to send Mr. Leblanc or Mr. Duclos answering our request.
And I just want to add, because I think Andrew hit a key point. Everyone in this room and everyone across this country understands that we've been through an unprecedented time in our history, internationally, much less here in Canada. And in a time of disruption, that's when innovation happens. And you don't see that innovation by ignoring opportunity to engage. You take advantage of innovation by engaging, and it's completely absent right now. And that's the tragedy. It's out of sadness, not anger, that we sit here today. We have work to do. We have ideas. The federal government might have some ideas as well. Let's exchange views. Let's talk about how we get out of this, making Canada a better place. And that won't happen by exchanging barbs through the media.
Next question, please go ahead.
Bonjour, Michel Sabat de la presse canadienne. D'abord, monsieur.
Hello, La Presse. First of all, Mr. Legault, could you repeat what you just said in French, please?
Yeah, oui. On est
Yes.
13
Currently, you see 13 premiers
et territoires
from the 13 provinces and territories, and we are all saying the same thing. We're asking for the same thing.
besoin d'une
We need
le Premier
a
ministre
meeting with Canada's Prime Minister. We need to discuss financing of healthcare. At the moment, we are spending
milliards de dollars
over $200 billion per year
province pour la santé.
across the provinces
Les
for health.
provinces et territoires,
The provinces and territories
18
pay 78%
milliards,
of
n'est
that
pas
amount.
capable
We can no longer do this.
à payer
We can't continue to pay 78% of these costs. It's a clear message, I feel at least. I think it's important.
devrait
It seems that Mr. Trudeau should accept our invitation.
être insultant
And it's quite an insult to delegate these messages through Mr. Duclos,
santé fédérale,
Minister of Health,
Comment-
Federal Minister of Health.
la santé fédérale
And how can a Minister of Health
des provinces et des territoires, c'est
even exist federally when it's a
C'est très-
provincial
que M. Trudeau
jurisdiction? That's one problem, but it's an insult that Mr. Trudeau does not wish to meet with us.
Sorry, next question, please.
Beaucoup. Donc, je vais poser ma question en français, mais
I'll ask my question in French.
you to answer it also in English. Donc, Monsieur Kenny nous a dit tantôt en français.
Mr. Kenny said earlier in French that Alberta will be ready to offer
En échange,
a guarantee to not reduce its healthcare costs if it gets
savoir
funding from the federal government, if this is a condition of the federal government. So are other provinces also ready to give such guarantees or to accept certain conditions from the federal government?
Puis un des
We've said this, and one of the problems that we're seeing is that at the moment,
augmente de 100
healthcare spending is going up by 5 to 6% per year.
le même niveau de service.
So even if we want to offer the same level of services because of the impact of the aging population and new technologies,
Personne ici là, qui veut réduire
I think that
de santé pour
it's safe to say that no one here wishes to reduce healthcare costs. We continue to grow these costs.
fédéral.
And the government has been saying for 3 years
Mais que fait-on
that they're going to give us these non-recurring payments over the next, over the next years. What are we going to do if we don't receive money from the federal government? That's the main question.
Joey from the Toronto Star. My question is for Premier Doug Ford. You came here looking for some consensus and support on the issue of immigration, especially as it relates to the labor shortage. How did the discussions go, and do you feel you got the support you were seeking? Is the statement that's been put out, is it strong enough?
Thank you for the question. There was a consensus. And do you know what's amazing? You see 13 premiers from all over the country, all different political stripes, and we always work together. We have full consensus before we leave that room. What we're seeing right now across the country, and I'll speak for Ontario, we have a historic labor shortage. We haven't seen a shortage like this in over a generation. I'll give you an example. As of this morning, the numbers I received from our team, we're short 378,000 people. That's 378,000 people that could be contributing to our economy, and we're facing a worldwide economy right now. If we don't fill those jobs, someone else around the world will fill them. The biggest challenge that we're seeing is the speed of getting new Canadians to come here and going through the process. It takes anywhere up to 26 months. That's challenging. And out of that, we were able to get 9,000, we called economic development immigrants, and we asked for more. And are you ready for this? The federal government, out of the 9,000, said, we'll give you 700 more. We're short 385,000 people. That hurts the economy. That hurts our GDP. We're losing billions of dollars of productivity here. So what I'd like to recommend to the federal government, you know, when these people come in, I get it. If you're backlogged, that's fine. Do 2 checks. Do the security check, do the health check. Let us do the rest of the paperwork. We're all willing to pitch in to help you. You know, we're one country, and we're there for you. But it can't take 26 months, over 2 years, and even up to 3 years to get people here. It's absolutely unacceptable. We need minimum of 20 to 25,000 economic immigrants in Ontario that we can choose. And we're short 378,000 jobs right here to be filled by these companies that are in desperate need. When I was on the campaign trail, I went from one end of our province to the other, and the #1 sign I saw, not election signs, it was help wanted signs in small businesses, medium businesses, large businesses, and all you have to do is go to a restaurant, and you ask the owner of the restaurant, they're short staff. Ask your own employer. Every company out there needs people. So we're willing to help the federal government, but we need their help right now.
Next question, please go ahead.
Véronique Prince, Radio-Canada. J'ai une question pour Monsieur Legault, but if
La presse, I have a question for Mr. Legault, and if others want to answer, they may.
Dominique Leblanc
Regarding Dominique Leblanc's interview with Power and Politics, he referenced
qui ont été remis
the checks that were given to Quebecers, and he said that if we transfer money, the provinces can't reduce their healthcare spending and
Vous êtes senti visé?
use the money elsewhere. How do you feel about this? What was your reaction to this?
D'abord, c'est tentant de
First of all,
répondre aux
it's tempting to say that we're going to respond to the Prime Minister's comments and not his ministers, but oh well. Let's remember that this $500 check that we gave Quebecers was a one-time payment, non-recurring.
pour des
And now we're talking about
du personnel de
hiring people, paying nurses,
pas si M. Leblanc
recurring payments. So I don't know if Mr. Leblanc is doing this on purpose or if he just actually doesn't understand. There's a difference between a one-time non-recurring payment
d'augmenter
and
les transports,
long-term needs, and this need for
entre autres, financer
increasing CHTs to
deux
pay people. I think that we're really mixing 2 separate things up, and I think that Mr. Leblanc understands that that has nothing to do
ponctuels.
with
Si on pas,
these checks.
en général,
Let's not forget that overall, Quebec,
les Québécois payent plus d'impôts.
Quebecers pay more taxes than in other provinces, so please also keep this in mind. And I would say that there are 2 emergencies in Canada at the moment. There's the emergency of inflation and the cost of living, and the other emergency, which is the healthcare emergency. The government needs to address both of these issues, both of these emergencies. That's one thing that the public is asking for, that we're seeing that in all our provinces. So we've all got different political parties and different policies to address this issue. We dropped the gas tax in Alberta, but at the same time, we added $2 billion to our healthcare budget. And as Francois said, we hope that this cost of living and inflation crisis will be just a short-term crisis. But of course, this healthcare capacity crisis, which was really brought to light during the pandemic, is really a long-term problem. I don't understand why we just can't have a way to address this crisis together.
Minister LeBlanc saying provinces are addressing cost of living issues, that means they're wasting money not putting it on healthcare, but there are in fact two crises, major crises and priorities in the country right now: inflation and the cost of living, and healthcare capacity. And as leaders, we have to address both. That's what we're all trying to do in our own ways. In Alberta, we've done it by dropping the fuel tax, but also on the other side for healthcare, increasing the budget there by $2 billion. We all hope the inflation crisis is a short-term one. The healthcare capacity crisis is a long-term one, and the federal government simply has to be part of the solution.
Yeah, and I would add to Francois and Jason's comments that we're talking about long-term, sustainable, predictable funding so we can build out the infrastructure that's needed in terms of our post-secondary institutions to train the next generation of healthcare workers, ensuring that we have access through immigration. Like, all of the questions that are coming really come back to the one thing: providing services for Canadians. And if we're going to do that, we can't do it with one-time funding. The issues around inflation and fuel prices and the impacts on pocketbooks are issues that we hope, as Jason said, are temporary. The challenges in healthcare are going to be long-term, and we need to start working on it right away with a plan that doesn't just have one-off funding, which is the preferred model for the federal government, but a sustained funding over time so that we can build out that infrastructure, which includes, of course, people to provide services to other Canadians.
Next question, please go ahead.
Bonjour, Nicolas Lachange, Journal de Québec, Journal de Montréal. Monsieur Legault, une question, mais pour vous, mais ça pourrait être aussi pour vos homologues. Monsieur...
This is a question for Mr. Legault or his colleagues. Mr. Kenney proposed a proposal on free trade, which goes well beyond the current proposal. What do you think about the recognition of professional accreditation? We all agree that we want to facilitate exchanges between provinces. We see, for instance, with the United States, they become much more protectionist. This is yet another reason to encourage provinces and territories to facilitate internal trade and facilitate also recognition of accreditation of professional skills and training for people to travel from one province or territory to another. We all agree more has to be done.
Étant donné que j'ai été mentionné dans la question, je souligne que dans la déclaration, dans le communiqué, il y a un engagement pour accélérer la reconnaissance des titres professionnels partout au pays. Nous l'avons fait dernièrement avec une nouvelle loi sur la main-d'œuvre qui reconnaît effectivement sur le champ les titres professionnels des Canadiens qui déménagent en Alberta. Mais deuxièmement, je suis très reconnaissant que tous les premiers ministres étaient d'accord pour donner une direction à la table de concertation sur la réglementation de la Fédération pour accélérer le travail, pour développer un modèle potentiel, je traduis, pour reconnaissance mutuelle des réglementations avec une option d'une liste négative. Ça, c'est exactement ce que j'ai proposé dans la conférence de presse. C'est ce que nous avons lancé avec l'étude. Et j'aimerais remercier tous les premiers ministres d'être d'accord à cet égard.
Brenna Owen, CP.
Thank you. This question, I think, was touched on in French, and I'll direct it towards Premier Horgan, but if anyone else would like to add. Premier Horgan, you said earlier today that any health transfer money would go into a pot, and it's the province's jurisdiction to figure out where that goes to support public services. And I'm wondering, what if the so-called conditions that we've been hearing about from the federal government relate to spending the money specifically on healthcare, some of the priorities that you've identified? What is your understanding of the possible conditions, and are you concerned that that's a sticking point in coming to the table?
And this is the challenge. If we have to engage with our federal counterparts through media interviews, I've written to the Prime Minister in December, no response. We sent a package of principles that we felt would guide a discussion, no response. And now it's, well, we want you to spend it on specific things. And we're fine with that. And what we all agree on is that there are a range of issues that are affecting the healthcare delivery across the country, but there's different nuances and emphasis depending on where you live. Demographics have a lot to do with it. For example, where you have aging populations, long-term care is a higher priority than primary care might be. And so in Alberta, where there's a younger population, the needs of the healthcare system are different than they would be in British Columbia or other provinces that have aging populations. So the whole point of us being responsible, our jurisdiction to deliver the services is we're better placed to make those choices based on the needs of the communities that we represent. Therefore, had historically a transfer of resources from Ottawa, which we then distribute within our healthcare budgets. And I don't want people to, or certainly don't want the federal government to take a clip from a news conference and say, see, they're going to use the money for something else. We get money in and we send money out to provide services for people. And the number one cost driver for our budgets, the number one issue for our citizens is the delivery of healthcare services. So there's no debate about what we would do with a healthcare transfer, except what the emphasis would be province by province by province by territory. And that depends on what the circumstances are, whether you have a sufficient number of primary care providers, or you need more acute care providers, or it's another infrastructure piece that you want to invest in. We believe that we have the responsibility to make those decisions. We believe the federal government has a responsibility. If we have a national program guided by the Canada Health Act, then they certainly should sit down with us and we should engage with how we best deliver those services for the citizens that we all represent.
I would just add that Premier Horgan's done an incredible job of communicating this as well. And I think it's important to understand, and I think Canadians understand, that that's a bit of a false equivalence, especially around when forcing a choice between cost of living and healthcare. The next thing will be healthcare versus pavement. That's a false equivalent. We just want to get to the table to talk about the funding, to move beyond the conceptual framework into a more substantive discussion collaboratively with our federal partners to achieve these goals. And I just would reiterate, there's none amongst us who wants outcomes in healthcare to worsen. We are committed to improving the system. We're committed to improving outcomes and results for patients across the country. And so I don't really see a big gap there, but I do see a debate developing that I do believe is false.
Next question, Andrea Wu, Globe and Mail.
Hi there. So Ottawa has indicated that it wants to see some accountability for any additional funds, that Canadians want to know how this money is going to be spent. Premier Horgan, in your remarks this morning, you said that provinces and territories are accountable every day through their legislatures, that the federal government is creating a problem that doesn't exist. But during the COVID-19 pandemic, we saw an Auditor General in Alberta saying that because of poor record keeping, we have $4 billion meant for COVID-19 initiatives. And we don't know what that actually achieved. In Ontario, $210 million that was meant to go to small businesses went to those that were not qualified. How did the premiers respond to that?
Well, I'll start, and I'll certainly let the premiers that you identified take a stab at it as well. We are accountable to the citizens that we represent. The federal government is not a superior order of government. It's not a better order of government. It's an equal order of government. And we'll take no lessons from the federal government in fiscal probity. I think there's an issue or two over time that Auditor Generals in Ottawa have highlighted, or the Parliamentary Budget Officer have suggested, were grotesque or egregious expenditures. So point made, federal government, if you think that you're somehow superior to us in terms of our ability to manage these issues. But none of that matters to the people who are waiting for a hip replacement. None of that matters to the people who are in a hallway because the ERs are crammed, because there are not enough staff to move people through. None of that matters. None of that matters if you are on a cancer wait list and you can't get access to the chemotherapy or the radiation you need. So it's all, again, well and good for people to sit in Ottawa, 3,000 miles from where we are today, and suggest that they somehow are superior in managing the finances of the country than we are in managing the finances of our provinces. We are accountable every day to the people who elect us, and they are the ones that make a determination about our effectiveness or lack of effectiveness on election day, and that is the ultimate accountability. The federal government is in Ottawa telling us that we're not doing a good enough job, but they're also saying we don't need any more resources because there's plenty in the system. You can't be both of those things at the same time, and we need to sit down and stop talking between this table and the federal government through all of you good people who've come here to transcribe our words and send images across the country. Canadians don't want that. They want us as adults to sit down and figure out how we deliver the services they demand, and of course, they pay for it. The money in Ottawa isn't Ottawa's money, it's Canadians' money. And guess what? It doesn't come from Ottawa, it comes from provinces. We're asking for some of it back to provide the services that Canadians expect us to deliver. And I'll let Doug and Jason take on
thanks.
there.
First of all, every dime of what we spent on extraordinary investments during the pandemic was for public health. And all of that is obvious, just like every other province. All of that in due course will be fully public and can be reviewed by the legislature, the public auditors, and others. But it's true that in the midst of the pandemic, like I'm sure every other government, our focus was just responding in real time to the emergency and not clearing through mountains of paperwork. There's no doubt about it. We cut the normal corners on procurement, because there were days, remember we were on calls as a group early on when provinces were days from running out of critical equipment. So we were all doing whatever it took to get warehouses filled with ventilators and PPE, to get additional medical supplies, medication, and everything that was required all across the system. All of that will become evident. We certainly have the same kind of generally accepted accounting principles as all governments do, all of it fully transparent, reported to the legislature, reported to the public. We've actually increased funding for the Alberta Health Quality Council, which measures health outcomes. We brought in Ernst & Young to do a performance review of Alberta Health Services to find efficiencies and so forth. And I don't have any objection to sharing all of that and more with the Government of Canada. I think that's actually quite reasonable. And in the last Health Accord 2005, there was a reporting obligation for provinces to report back. I think that's quite reasonable. But how do we know that that's what they want when they've never actually sat down and said it to us?
We will take one more question in the room. Shannon Waters, BC Today.
Don't get to do that very often. Thank you, Tara. I'll direct my question to Premier Horgan, but if any of the other premiers want to chime in, feel free. You've mentioned a couple of times in these past couple of days the need for a national framework to prevent provinces from having to compete with each other, from poaching from each other when it comes to recruiting and retaining healthcare professionals. And I'm hoping you can provide some details on what that looks like. Presumably, training and recruitment would be priorities there, but I'm curious as to whether that also involves a triage system or prioritizing staffing needs. And so is that something you have some specific ideas on at this point, or is it just an issue you've identified that needs to be discussed with Ottawa at this time?
Right. It's the latter. We have been appealing to the federal government to sit down with us so that we can establish frameworks for engagement across the country from coast to coast to coast. We need to do that so we can all have comfort that all of us have been in unison on this question for at least the 5 years I've been here. Sandy's been here for 6. And this was the issue when I arrived, and it's the issue as I leave. And the federal government has refused to come and sit down with us and engage with us about what they believe the best way forward is beyond power and politics. And so if that's the state of our federation, then I'm not as optimistic as I was when I got up this morning. I'd like to think that as we look at the challenges that we all face in this unprecedented time, I think we need to hearken back to that. As Jason said, 24 months ago, we were collaborating in an unprecedented way. What Ontario required, the rest of the country was working to make sure that we could deliver. I know that Jason in Alberta had a backlog of personal protective equipment that we were able to distribute across a surplus of materials that he welcomed the rest of us to access. Premier Fury and his spouse traveled to Ottawa as physicians to help out. I mean, there was unprecedented collaboration, and the federal government was right there, and we applauded that engagement. It was an unprecedented time for all Canadians, but it was also an unprecedented time in our federation. And now, 8 months later, we're exchanging notes through the media. You know, where'd the love go? You know, I mean, everything was so fine, and then it wasn't. I mean, this is, it's vexing that we could have made so much progress together. And now, when we all recognize that the cracks in our precious healthcare system are there for all to see, most importantly, our citizens who want services, when we turn to our partners, our allies, and say, hey, let's get together and figure this out, they go, no, you got enough, or you're going to waste it, or maybe we can't talk to you right now, there's something else going on. What could be more important for the Intergovernmental Relations Minister than to relate with the other governments of Canada? Is there anything else on his docket beyond the 13 of us? I wouldn't think so, but here we are.
I'd just like to specifically comment on the question with respect to mobility across jurisdictions. I think that, as we've said many times here today, this moment of disruption caused by the pandemic creates an opportunity to look at the practice of medicine very differently. And we know new generations like to practice differently than old. The old paradigm of hanging a shingle and being the only physician or nurse in a community, that's just not going to fly anymore. And the longer we hold on to that romantic notion, the harder it is going to be for the system and, more importantly, for patients. So when looking at mobility across jurisdictions, I think it's a creative way to unlock new potential of employment, new potential of service across the country. Because I know there's barriers when you're a physician, for example, to practice in other areas. It'd be very cool and interesting to do a locum in BC, you know, and do some total hips in British Columbia, but there are barriers to that, significant barriers. And so if we look at a national strategy and to eliminate those barriers and allow physicians and nurses to cross jurisdictions, I think that's a creative way in using that in combination with new technologies that we've harnessed during the pandemic to provide services, especially to our rural communities. So I think that this is an opportunity, one that can't be lost in the rhetoric that unfortunately seems to be evolving.
Can I just add, John, I take my time back to being a staffer working for Premier Binns when the Council of the Federation began. And at that time, premiers were meeting, trying to get a meeting with the Prime Minister to talk about more money for healthcare. So we all understand, I've talked to many of you, we all understand that there's a certain frustrating romantic dance in this whole thing, but I do feel that the factors are different now. It's changed, that like we're in a situation that we can't go on with this silly back and forth. I'll talk to the media, you say this, I say that, we'll frustrate the premiers will respond, and we'll do this silly dance. The factors have changed so much that we need to put aside this silliness, and as we did through COVID. I mean, we had 26 or 27 meetings with the Prime Minister. We talked weekly almost to get through a situation of challenge that the country needed us to come together to do. We're in that now with the overall delivery of health care. And I think it's incumbent upon all of us, it's incumbent upon our colleagues in Ottawa to put aside some of that silliness. Let's not let that be the norm again. Let's get back to do what islanders in my province and Canadians across the country want us to do, is let's get some solutions to some of these challenges. Why do we want to mess around with this little dance? Let's get the work done. And I think that's why you're hearing the frustration from this table. But I think, you know, Canadians are I'm assuming, quite frustrated with it as well.
I would like to add something to this conversation in relation to the people and the nurses and the health professionals that are in the hospitals. Premier Fiore can talk directly about the surgeon and the family physicians and what that means and how innovation has to change in the system. But we met this week with all of the nurses, with the nurses union across the country. And you know, we've heard many stories about 24-hour shifts and the concerns about being in the ERs and safety. I think the opportunity is how do we address those concerns that are every day? Simple things like the scheduling, you know, like they're getting burned out. They can't even have flexibility in the scheduling. I think there's There's money needed to have a continuation and a better healthcare system, but there's also an opportunity to engage employees right in the front lines in the hospitals that are delivering the service. Nurses are saying we need more nurses. Yes, we do. But we need innovation. We need better healthcare that's delivered every day by the people that know it best. And I think it's time we listen to those people and got their information firsthand of how we can change. And when we talk about interaction between provinces, it's where are best practices and how do we not duplicate services, but how do we complement services? And I know during COVID in New Brunswick, we have two healthcare systems, Vitality and Horizon. But we work together like never before to deliver healthcare in the province. And we learned that we can do that better together than we could as two independent. So yes, we have two systems, but they can complement each other in their service delivery. And I think what we're seeing is we can broaden that between provinces. And we've had that discussion in Atlantic Canada. So the opportunity for us to be better at what we do is all part and parcel to more money to help us there. But we can deliver a better result with people being part of that solution.
We will now go to the phone lines. First question, Dylan Robertson, Winnipeg Free Press.
Premier Horgan, you're coming away from this summit with no visible movement from Ottawa on the health transfer. If anything, there's been more pushback from Ottawa now since your initial demand in 2020, and you don't seem to have a lot of leverage. Ottawa says that there needs to be strings attached to the money that it's giving, but your statements today don't show an open further behind than for a week ago, and also if Premier Stephenson would like to weigh in on that.
Well, I'll start, and Doug and Heather can follow. In terms of leverage, this isn't a wrestling match. This isn't a battle of titans. This is partners collaborating to deliver services for our fellow citizens. This is not a one-upmanship effort here. This is about let's get together. We've got a whole bunch of people here that are delivering services in different and diverse communities. We have different political perspectives we're sitting down together to figure out how do we go forward. And we're looking to our ally, our partner in Ottawa saying, hey, how about it? And we get back this, well, we're just not prepared until there's conditions. What conditions? Tell us what these conditions are. Well, you won't give tax cuts to your citizens. Well, we can walk and chew gum at the same time. We have multiple responsibilities within our jurisdictions, and the primary one is delivering healthcare services. But we still have to keep, in BC, the ferries have to keep running, the highways have to be maintained, the schools need to be populated and built, and all of the other things that we do in our society to be one of the most desirable places on the planet to be. It's not about, well, if you don't do it our way, it's not going to happen. We need collaboration, cooperation, and that's what we've been doing for 5 years. And the federal government just needs to join us. And if they have ideas and they involve conditions, if they involve best practices, if they involve any number of things, happy to have the conversation. We sent, at their request, a series of initiatives that we wanted to pursue, and we got zero back. I don't know what to say about that. We can't negotiate with ourselves. Someone asked me the other day, well, I want to know specifically what you're going to do with the money. I said, well, why would I engage in that when I just need to deal with the money I have and the services that I need to deliver? When we get to a place where we're talking about how we're going to distribute the money, we can have a discussion about where it's going to be spent, but it's counterproductive to say, before I give you anything, you need to tell me exactly what you're going to do with it, because this is a dynamic situation we're in, and it always has been, and it always will be. And it wasn't a problem in the past for Canada to say, as they did in 2004, let's figure out a way forward, and they tried to do it again in the last decade. It is 2022, people are living longer, services are getting better, we're more sophisticated and more innovative in the delivery of healthcare services, and that costs more money. This is not Mayberry anymore. We're not in Kansas anymore. It's Canada 2022. We have a publicly funded healthcare system that needs an injection of cash, and we need to talk about how we do that. Come onto the table, Ottawa, and we're happy to do that.
Just briefly, Dylan, thanks for the question. And this is, and you and I have talked about this before. This is the #1 issue
one of the most important issues across the country right now, and all we're asking for is for the federal government to come to the table. We're not afraid of things like accountability to our citizens. We do that every day. We're accountable every day, and that's been mentioned here today. We're not afraid of getting better results. We want to get better results for Canadians when it comes to healthcare, and so those are the issues that they seem to be talking about as reasons that they don't want to sit down with us at the table. And to me, I just think that's really disappointing. I think Canadians really want us to be working together in different levels of government, taking a more collaborative approach to these things. And I can just say, just quite honestly, from my perspective and from Manitobans, that's very disappointing. They want to see us working together. I hope that they will put whatever it is aside, just come to the table so we can start to have those discussions.
And I just want to intervene and say, I'm not afraid of accountability. I'm from the Northwest Territories. We're not afraid of accountability. We have open books. We get audited all the time. Come and see what we're spending our money. But the needs of each jurisdiction are different. Canada is diverse, and we're well known for that and appreciated worldwide for that diversity. In the Northwest Territories, if all of the money was to go, for example, into long-term care, we care about our elders and our seniors dearly. But we have communities in the Northwest Territories, because of the short staffing, we don't have a health center. We've closed down the medical care facility in communities. Could you imagine living in a hometown, and if you have an emergency, something happens to your child, to your parent, to yourself, that you can't even get a service? So that is what we're talking about. We need the flexibility. I'm willing to show you where we spend our money. But don't tell me that I have to spend it all in long-term care when I don't even have a doctor and a nurse in our communities. So every jurisdiction is different. We all have different needs, and we're all accountable. There's not one of us that doesn't have to open our books. But the point is that if you're not even at the table and talking to us, then you can't even hear those concerns. And all we're asking for is come to the table, hear our concerns, work with us. Thank you.
Thank you. And I guess what I'd say is I think you're seeing it's pretty unanimous here. There's not a community in this country that you could go to and stop somebody on the street and ask them what they think of the state of healthcare. You get the same answer in every single community. We have a lot of work to do in healthcare. And the only thing we're asking for is the federal government to come and talk to us about it. And if they don't want to do that because they're afraid it's going to cost them money, well, then there's a lot of big issues that we need to get through, starting right there. But I mean, if they want to ask us, well, what are the outcomes we're focusing on? I can tell you right now, in Nova Scotia, there's nurses being called in from vacation because they're needed on the floor. Those are the outcomes we want to fix. That's what we want to talk to the federal government about. If they want to talk to what are the outcomes that we're going to address, we shared stories today about emergency room physicians who are just burnt out and exhausted and are afraid they're going to make a mistake at work because they're tired. They need help. They need our support. Those are the outcomes that we want to address, and we just want to talk to the federal government about it. I can tell you there's nobody up here who's trying to scrimp on a healthcare budget and divert money somewhere else. That's not happening. Of course, we want to spend the money on healthcare. Of course, we want to spend the money to improve outcomes. The only thing that is stopping that progress on that is the federal government's willingness to just sit down and talk to us. That's all we're asking for. I mean, it's really not meant to be a controversial ask. Just come and talk to us. There's lots of stuff we can do together. We want to do that.
I think over the last couple of years, the challenges everyone's gone through worldwide, across Canada, and as Canadians, we all pitched in. We all worked hand in hand with each other. The provinces all helped out. Dr. Fury sent his lovely wife Allison over to Ontario to help us out in a desperate need. But everyone pitched in. And you keep hearing the word collaboration and cooperation. That's all we're asking for. We all have a great relationship. I'll speak for myself. I have a phenomenal relationship with the Deputy Prime Minister. I think the world of Chrystia have a phenomenal relationship with Minister LeBlanc. You know, as the Premier's heard me say, I think he's great. I must have said it 3 or 4 times in our meetings over the last few days, but that's what's bothersome. You know, we need to sit down. Canadians expect it. They expect us to work together. As I said earlier on, they don't care where the money's coming from, but the burnt-out nurse that's working around the clock, you know, 24-hour shifts, you know, they need the help from the province and the feds. When the doctors are being burnt out, they need the help. When we're hiring more nurses, and Ontario hired over 10,000 healthcare workers since the pandemic. We created 3,100 more beds. We put $40 billion into infrastructure, into new hospitals, 50 new hospitals and expansions right across this province. But it's not sustainable. Even as the largest province, we cannot continue at the pace we're going without the support of the federal government. And you're hearing the same tone from everyone. Just come to the table. It's not, you know, you against us. It's all the same taxpayer. There's going to be accountability at all levels, and we just need your help. So we're asking to come to the table, and we'll work with you. And that's the only way you get things done. Not going through the media, and I say that respectfully to the media because you're doing the job you have to do. Come to the table.
John, I'd just add to that as to the something Andrew had said a few minutes ago around the missed opportunity that that Canadians are missing by essentially the federal government not coming to the table, having the conversation with the 13 individuals that you see in front of you here today. And I would use an example as we found our way through the last couple of years and through our Canadian experience of what was a global pandemic. We met weekly, us 13, the 13 premiers, or maybe it was a little different variation of us during that period of time, but we met weekly for much of that time, and we met either weekly or bi-weekly as well with the Prime Minister, and the Deputy Prime Minister often was on those calls as well. And we had put together you know, a partnership funding agreement, a partnership support agreement being the Safe Restart agreement. It went far beyond healthcare, but was based in supporting Canadians through what was a very challenging time. We saw the federal government procure vaccines. We saw the provincial and territorial health systems actually deliver those vaccines to Canadians. We saw the Canadian government procuring PPE equipment. We saw the provincial entities actually then dispersing that equipment to Canadians. We saw testing facilities pop up across provincially and territorially operated testing facilities pop up across this nation. Yes, there was some financial support from the federal government so that we could provide the services that Canadians needed over what was a very, very challenging time for all of us on Earth, I would say. But in addition to that, we saw additional federal funding that was provided and then added to by the provinces for schools, for example. In Saskatchewan, we had $75 million, I believe, came from the federal government. We added another $80 million to that and provided that to our school divisions in the province to ensure that they had the funds to keep our children as safe as possible through this very challenging time. The municipalities that were you know, running their transportation systems at maybe 25 or 30% of the rate that they normally would. The federal government, yes, did provide some dollars, in our case about $70 million that we flowed through to municipalities, and we added $150 million to that to keep our municipalities as funded as possible through what was a very challenging time from their desk as well. I would say that relationship and that agreement and that discussion that we had over 20 or 25 meetings, I suspect, 36 meetings, I'm correct, I stand corrected by the current chair, is really an example for us to come together once again and to actually have a very fulsome conversation, not only about how we're going to support Canadians from a healthcare perspective into the decades ahead, and quite frankly, the provinces aren't going to be able to do that when they're funding 78% and likely that percentage increasing in the years ahead. But we're going to miss out on the opportunity that Andrew had alluded to with respect to how we are going to shift and change this healthcare system that needs to look quite different in the future. The last significant increase we had in the Canada Health Transfer was some 30 years ago. You think of the healthcare system we have today and what we're asking it to address and how we're asking it to service Canadians today versus 30 years ago, and you think about what we need to do in the decades ahead. And most certainly, this is an opportunity, and I think Canadians should be disappointed that this is an opportunity that, as it stands today, the federal government is missing out on participating in.
I'm just going to add a bit here too, if that's okay, John. You know, I've been here 6 years now, the longest standing current premier, and I've never seen this table so sophisticated in all of my time. The conversations that have brought us together during the pandemic, the conversation about mental wellness and substance abuse that all of us did with the Promising Practices podcast, the conversations that we've had with every jurisdiction, what work we're trying to do to modernize healthcare in our communities. And I tell you, when we were in the pandemic, when we told Canadians hope is on the way, there's a light at the end of the tunnel, vaccines are coming, you know, there's going to be better times ahead. It's that hope that really did help a lot of people to say, we're going to dig down a little bit more and we're going to bear down. And what we're seeing right now is nurses and doctors in ERs that are afraid that they're going to hurt themselves or their patients, and they're looking for us to find solutions and to come together and to share all this information together. And we've been told to begin with, wait till COVID is, you know, no longer such a big issue. Wait in between the two elections of the big provinces. We've been told a few different times what to wait for. We need a date. We need to know exactly when we can get to that table. The nurses are ready. We met with them this week, and they talked about how they would love to be at that table as well. Dr. Catherine Smart, the president of the Canadian Medical Association from Whitehorse, met with us as well. They're ready to come down and talk about best practices. They're ready to talk about what we could do to modernize this system. We need the federal government to tell us when we're going to have this conversation and give some hope to people that are on their last strings right now. Thank you.
Last question today. Camille Baines, Canadian Press.
Hi, I'd like to know if there were any discussions on how limited resources, even if it's 35% from the feds, could be stretched to benefit multiple jurisdictions. So if you have a specialist who treats a rare disease, could that person not be doing virtual appointments in different provinces?
Well, that's a very good question, and that's the type of innovation that is happening now amongst the deliverers of the service. And we can enhance that by having, again, a national discussion and dialogue with the federal government about how we further advance those types of initiatives. We don't need to recreate wheels. The Romano Commission how many years ago was that? A long time ago. Laid the foundations of what the expectations were then. We don't need to go back to that. What we need to do is find better ways to deliver the services that people expect. And with innovation in the sector, whether it be pharmaceuticals and other therapeutics, whether it be new technologies, whether it be diagnostic or otherwise, it's how do we collaborate across the country as we did through the pandemic? How do we do that going forward? And to do that, we believe we need to have a partner, an equal partner in the federal government, which has been the foundation of delivering health care in Canada since the 1960s. And again, it separates us from our cousins to the south. We are the envy of North America because of what we have. I talked to Governor Jay Inslee, my colleague to the south of us in Washington State, and he would love to have a system where anyone who needs health care can get health care without checking with their banker first. These are things that we take for granted in Canada, but we need to remind ourselves how precious this is, and we need to put care and attention towards making sure it will be here for us a decade from now and 2 decades from now. I don't know if anyone else wants to. Andrew?
Yeah, just at the risk of sounding really repetitive, now is the time, during this time of disruption. I used to see, for example, patients from across Newfoundland and Labrador travel 8 hours for a 2-minute appointment. I think that the pandemic has shown that, you know, you could probably do that visit virtually, but that requires, what you're describing requires an investment in technology, an investment in broadband. It involves a structural change in how we license physicians and nurses across the country. But more importantly, it really unlocks the value across this table. It unlocks the collaborative value here, but it also unlocks the value of medical professionals. And I practice around the world that is the strongest here in Canada. And I think despite some of the conversations here today, there's a significant amount of hope and optimism for a modern system that is sustainable and one that addresses the permanent needs of Canadians long term. But this is a generational opportunity right now. We all recognize it, and I hope the federal government does too.
Okay, if we can everybody just face forward, we'll take one quick picture. Wonderful. That's all the time we have. Thanks for joining us today.
And just before you all go, for those of you who've come from away to Victoria, I want to thank you for coming. And if the federal government needs any encouragement, I'll just say that we in British Columbia know that the weather is a federal responsibility. So I want to thank the Prime Minister for the past few days. It's been outstanding. And best of luck to you all. Salut. Safe travels home.